Hello and welcome to the May 2020 Pre-Hospital Care Research Forum Education Research Journal Club podcast. The Pre-Hospital Care Research Forum is dedicated to the promotion, education, and dissemination of pre-hospital research. We believe that it is the responsibility of EMS professionals worldwide to build a body of evidence to examine pre-hospital emergency care. The PCRF partners with the National Association of EMS Educators to promote research literacy and advance the science of EMS education research. Here with the PCRF Journal Club, we take a closer look at some of the latest research happening in medical education. I'm Megan Corey, and I'm here with David Page. Katie O'Connor is joining us today as well, and maybe Dr. Bill Toon, although he had a little puppy emergency this morning, so we wish him good luck and hope to see him a little later in the podcast. This study that we're going to be looking at today is called Forced Disruption of Anatomy Education in Australia and New Zealand, an acute response to the COVID-19 pandemic, and this was published in Anatomical Science Education. Well, this is very relevant for all of us out there, so I'm sure we've got some educators out here who are listening who can sympathize with this. And if you haven't read the paper, I would strongly recommend reading the entire paper here because it's number one, it's very relevant to what we're going through right now as educators, and number two, it's very well written. So a very well written paper that I highly recommend taking a look at. Thank you all for joining us. We're going to begin, and we want to remind you that you can listen in and type in use the chat feature and type in some questions or comments as we're going. We'll bring those into the conversation. Or if you have something maybe a little longer to say, you're all educators out there, you'd like to maybe unmute, you can send a message through the chat to our organizer, and we can unmute you and let you join us live. So a little background, we know that educators and students around the world have had to rapidly adapt to maintaining continuity of education when we were using maybe traditional face-to-face formats to a remote teaching and learning. And I hesitate to say online or distance education because there is an entire field of evidence around online and distance education. So we want to give credence to those who have completed training and have become masters at online distance training. So this was really emergency remote teaching and learning that we're experiencing. So as we can relate in EMS training, many of these courses and programs rely on face-to-face, practical, hands-on labs and experiences for optimizing student outcomes or even to meet standards of education. Anatomy education is one of those areas where the expectation includes participation in a practical lab, often with a human donor cadaver. So not only do these experiences, and I really like this about this paper, they highlighted that not only do the experiences with cadaveric models and these human donors provide the opportunity for the physical hands-on learning, but they also allow the educator to frame their education through a lens of ethics and humanism in respect for the donors. I thought that was a really great point that was brought up in this paper. Now, in the countries of Australia and New Zealand, the COVID-19 pandemic, much like it did in other areas, resulted in progressive closures. So initially, they report that they experienced early on in the year the halting of travel. So your anatomy educators could no longer travel to maybe a conference. And that progressed to eventually stopping the attendance at certain events, and then finally an ominous warning to prepare for a sudden closure and then a sudden closure. This was mixed with some messaging, I think, from the, I don't know whether it was from the government or from the schools that, just keep going, business as usual, we're open. The message out to the public is we're still open for business as usual. And it was really far from business as usual. So that resulted in some conflict there. But then, and we'll see that some actually had a delay, and many of you probably had this experience. Took the time, maybe a week, to prepare and shut down and let the educators prepare to put things in a remote format and then resume instruction, and others just transition during the period. So this study then was designed to get the perceptions of anatomy educators. So the research question here is, what are the perceived disruptions and changes made to the anatomy education in Australia and New Zealand during the initial period of the COVID-19 pandemic as reflected on by anatomy educators. So what they did was they recruited anatomy educators by email. They got 18 academics from 10 institutions. They itemize, where they came from in the study, and you'll see that in one of the tables. And it turns out that a number of these educators were also, as we can imagine, are attached to allied health and medical school type training programs. It is anatomy. And they were asked to reflect on their experience, and this is important, from January, which is the start of their academic year. So unlike us, where we begin maybe in fall, traditionally at least, January is the beginning of the academic year. So there's a lot of, risk of maybe knockout, they call it knockout impact, because it's early on in the education. So they had these 18 academics from 10 institutions were reflecting on their experience from the beginning of January until the end of March. So they really were targeting the early stages. They focused on the early stages of this. And then they did, in qualitative research, we call it inductive thematic analysis, where you take the reflections and you code them. It's very, arduous. We've talked about that a little bit here before on this, about the task of transcribing and taking those transcriptions and coding, and then creating themes and common areas. This study was also approved by the Institutional Review Board at Monash University. So this is what they kind of underwent, and essentially, in a nutshell, I'll just give you the kind of Reader's Digest version, then we'll kind of launch into some of the specifics. But they found that the themes, the challenges that bubbled up here were, there were 4 categories, and you will probably all relate to some of these. Staff and faculty challenges, ones around students themselves, the infrastructure and resources, and the curriculum changes. But also highlighted were some opportunities of teaching anatomy in this setting of the pandemic, and they authors highlight some of those opportunities. So that's kind of a large overview of this, but let's dig into some of the details, and then we'll bring in, we've got Katie O'Connor here, we've got Dave Page here. So the first thing here that we see is in table 1 is a description of their the education approaches that were engaged, that these institutions, these universities that you can see on the left, and if you can't see, this table looks at some of the things that they instituted, the practical session delivery replacements. So you had the university name on the left, and then each column shows you what was the status of their human body donor program, what kind of lecture delivery did they use, what kind of online pandemic delivery did they use, what was their planned face-to-face, did they have one for a post-pandemic intensive? That's actually a really interesting concept too, and I'm really interested to see what folks have to say about that. And then what kind of active online learning did they employ? So Katie and Dave, I don't know if you can see this table, but we can see some of the patterns. The human body donor program status, by and large, was suspended for a number of reasons. And then there's actually, they bring up later in the paper, some concerns about the infection, maybe the concerns about safety and health and well-being that were expressed by students, that maybe, if they were going to interact with a human body donor even later, coming back to class, that might be something that's hovering over. But at any rate, these were by and large suspended. There's only one that showed that it was open during that time.
I think it's fascinating, and I'm so glad you picked this article. It's so contemporary, so really in the forefront of what we're thinking. And I'm really happy to see that our friends in Australia are taking the time to actually do some evidence-based practices and learning from each other while we're in this crisis. So I think that's certainly one of the takeaways. I love that the authors tried to say there's the world of teaching anatomy wasn't, you know, necessarily the safest world anyway. There's a lot of different risks involved, but here, is there something during or post-COVID that's going to make us be a little bit more concerned about these live events with actual, you know, human tissue? And it's interesting. I don't know how many paramedic students really have access to an event where you have a full cadaver. I think that happens a lot with paramedic programs where we're doing procedural labs, but in the anatomy and physiology labs, perhaps they're using either plastic models or some sort of electronic format in the first place. And the hands-on portion of some of the dissections may be done with other kinds of, you know, whether it's a heart that comes from a deer or something that is the pig pluck or some other
Mhm.
way in which we're doing the hands-on portion of those. I'm not sure. And in this environment, creativity becomes rather key. And so as
Yes.
we continue through this paper, I'm, I think the innovation that people were forced to do is hopefully something that continues on after COVID. I know, for example, at UCLA, we're going to need to teach our lectures online. And yes, even if we relax our standards to be able to do some small group activity, we the idea is not to have everybody come in unnecessarily. So we'll need to be very efficient about any
Hmm.
in-person activity, especially because of having to clean before and after, having to have small groups, having to have staff to, you know, address that. So keep going, but I think this survey even telling us, gosh, this is what we were comfortable with, this is not, is helpful for the whole profession.
I think we're doing this sort of informally right now too, with a lot of discussion groups and webinars and happening in EMS. And this is where I'd love to see people take another step and do something like this. If someone could formalize that and take it as a research question, and this could easily be duplicated or replicated
Yes, for
with
EMS.
EMS educators.
Wait.
Absolutely.
EMS educators doing research. Hold on. Somebody might have a heart attack.
I know.
Yeah. No, I think
Let's
it's important.
challenge Dave and
Yes,
change
yes,
this. But
absolutely.
this is easily replicated. I shouldn't say easily because qualitative research is painstaking, but it's really important. And I think this is a good article to read just again for the writing itself and how it's put together and replicating. So and as a team, if you look at the list of authors, I mean, I looked at I was typing out the slides and I said, okay, I'm tired. I'm just going to put et al. That's it because the list of authors. But that's, I think, an important point too. Don't sit out there by yourself saying, okay, I think I'll do this myself. You know, a nice team of people to ask this question. And, you know, send out an email is what it was for recruitment, and then a team to actually do the transcribing and or actually probably didn't have to transcribe because it was written responses, but the actual, you know, coding and analysis and arguing and discussing and everything else to come up with the themes. I think that would be a worthwhile exercise, in particular because let's dig into the instructional aspect of this, because that's the first challenge that they list. So the first challenge they list is challenges for staff. And I want to focus, you know, they were saying there's a number of great elements in this. So the first element of the staff was the focus on the pedagogy, the expectations for executing a new way of teaching. So you know, the common thing, of course, is the technology skills, but at the lack of prior training and knowledge. And I think some of this shows in Table 1 and when you're looking at the lecture delivery model that was utilized initially, which is, okay, I'm going to use pre-recorded videos that I've had over 3 years, or ones that I've had that are, we're just gonna, that'll be the easiest, the fastest, kind of pre-recorded videos. And then later on in the paper, they talk about how these were then maybe supplemented with some short videos with some maybe feedback or discussions or something that brought it to life and made it more interactive. But and the other thing was whether these were synchronous or asynchronous, and that's actually that's something that comes up quite a bit at my institution, at least, was the very inexperienced automatically assumed I need to do exactly what I did. I had lecture on, Monday and Wednesday from 9 a.m. to noon. So that's what we're going to do. And they have to be there at 9 a.m. to log into Zoom and hear me lecture with my same slides. And we're just taking it from face to face to an online model, without considering that students might have had their own pressures, their kids at home, their Wi-Fi issues, their own bandwidth issues, all kinds of things that then later came up. But this kind of desire to keep things the same but only online, I think is noted sometimes. Although I'm getting the impression that just from the asynchronous and synchronous mix here, and some of the ideas that came out in a very short period of time, that this was a group that was not, um, technology challenged a whole lot.
Yeah, maybe. But although I like the fact that they mentioned that the in the responses, people were feeling like they were pretty stretched and pretty stressed.
Hmm.
Even if they had done a little bit on this, they had to retool their entire syllabus. They had to, adjust sort of how they were going to do their labs. And I do like how they commented on using some of their old pre-recorded lectures, if they had any, or YouTube material, while they were able to, in their words, upskill their comfort level with
Hmm.
the technology.
I
And
love that
and
word.
I do love how they have time frames listed as to how long it took them to, in some cases, no time at all, in some cases up to 10 days to even just go, how do I do this? Wouldn't know how to do this exercise.
Yeah. The other thing I thought was interesting is they brought up the other staff that you typically have in an anatomy lab, which are, they call them demonstrators. I'm assuming those are like your lab aides, or lab assistants, whatever you call them, instructional aides, and what to do with them. I think they were trying to figure out. They said immediately they wanted to figure out mechanisms to involve the demonstrators, which turned out to be a very good idea. Some of them came into the lab after hours and created some little demonstration videos if they had access. A number of us do not have that kind of access, but if they did have that access, they did this. But then they also noticed that they the demonstrators and other technical staff really valued the new roles and showed adaptability and resilience. And automatically I had written in the margin here, were they younger and were they more
Of
tech
course,
savvy,
yeah. Well, and even if we're not, I mean, I think the innovative part of making things interactive. I love how they said they had to break things down into smaller chunks because the long lectures were just not going to be, effective online. Well, I hate to break it to them, but it's not effective in person either. So,
Exactly.
sitting there for hours listening to anatomy lectures, I don't know who thought that that was effective initially. It's just that people were forced to do it, so they just kind of did it. I think there's this whole aspect of you're being forced into the digital world and suddenly forced to do better education that probably should have been going on even in the classroom. And then you have tools like they mentioned here, some of the principles of that interaction with tools like Kahoot. I've
Hmm.
never used Slido,
Yeah,
Slido, so
interesting.
I'm curious to go check this out after the podcast. But clinical cases and the fact that people can use some of these platforms, you can draw on the slide, so people could draw the anatomy, right, or point out the anatomical or physiological features that were being discussed. And I'm obviously going to declare conflict here because of the work that UCLA did with the flipped classroom, but in every flipped classroom lesson, we have an anatomy piece where, we had them lay down on paper, cut a silhouette out of the paper, and then cut the bones and create a skeleton that they can actually, put up on a wall with a little bit of masking tape. And those are exercises like that can be done at home. It's not rocket science. And as far as we'll get into assessment here in a minute, but
Mhm.
the depth of interactivity and engaging their emotion, engaging their desire to show their peers how to do it, or how quickly they can do it. All those things can be done online with a camera turned on with a phone, a smartphone.
That's right.
So it is this thrust into this new world that, quote unquote, new. Well, it was always there, and thank goodness it was, and that tools like Zoom were able to upscale. Uh, I just can't imagine the millions of users that came on, in March, and still were able to, manage to have a platform that was stable. So.
Hmm. And now 6 out of 10 too. This is the other thing that makes me a little bit nervous. 6 out of 10 have a plan for quote post-pandemic intensive lab too. So come on in. We're gonna we have a week or whatever it is to
Mhm.
make up for this time. The reason why I say it makes me nervous is because it's very uncertain in the future. And maybe, when you look at the 6 out of 10, and this is in that plan face-to-face post-pandemic intensive right next to the online delivery, you can see that it says yes, but not, but the specific requirement is for medical students, you have one that says science students and graduate clinicians, but for the most part, it's clinical, and then forensic and mortuary students. So we have, yeah, it's kind of probably hard to do mortuary science without having a cadaver if you're learning something that's very technical. But, I don't
I've
know.
been
I'm
very
sure you
afraid
could
about
probably
this.
can. Yeah,
Yeah, I've
yeah.
been afraid of the backlog, as we say, well, this is a temporary certification, this is a temporary course
Hmm.
completion, this is a temporary, you've completed this kind of the backlog of the students who need to return and do skills. I know that Katie would be the first to say, gosh, when we start to, analyze the number of people we have to put through the number of scenarios, there's just no way to actually maintain the amount of time. And I'm sure will happen to all of us is that we will be starting new courses that also require the same resources, and the previous plus new all challenge us to go, we're going to have to think about it differently. And and I think they make a good case here for the adaptations may be adaptations that need to be good enough, not just good enough for a little bit.
That's right.
Yeah,
And
Dave
oh,
and
oh,
Megan.
Katie. Hmm.
Oh, sorry. Yeah, I was like when I'm looking at this chart, the suspension of the human body status is huge here because I don't know when that'll come back, right? So we could plan for allowing face to face, but for us at UCLA, we have a pretty intensive cadaver lab, not just for anatomy, but also for procedural skills. So we require our students to have 2 human tissue intubations, and almost all of them only get 2, and 1 is on a cadaver. So it's definitely a planning consideration, not just for the anatomy teaching, but for in a lot of paramedic schools, the procedural skills that maybe not available anymore because the cadaver programs are suspended or reduced.
Yeah. Have you seen that? It's a physical cadaver, not the giant iPad cadaver, but there's a physical cadaver that's like made of whatever, some kind of
Yes.
polymer
um,
that looks
Salt water.
exactly. Yeah.
Absolutely. Yeah. Can you imagine disinfecting every one of the pieces in that toy? I cannot even think
No.
about it. I really think, this is where hopefully this will cause people who are doing digital printing to go crazy,
Yes.
because the digital printing of a with 50 cents worth of plastic to be able to print all the pieces to a puzzle, which is the human body, and to be able to put these together will make somebody a killing, because if you can print for a very small amount of 5, 10, maybe, I don't know, $20 worth of plastic, every student will go home with their anatomy model. Now, I still come from the culture where we had anatomy coloring books, and we had an
Yes.
anatomy model. And I remember in some of our first courses, I went to the local anatomy shop at the University of Minnesota, and we would buy these put together, kind of puzzles that were models of human anatomy. And I think if we can get those at an affordable level for each person, then perhaps that again needs to be good enough until we can get ourselves back on our feet. The answer cannot be, well, we're just going to wait. We cannot train new providers, because we obviously have people who are out of the job because of either injury, illness, or death, and or are emotionally taxed to the point where we need to account for the number of people who are going to be leaving the profession, and begin the concept of we got to train new providers. I don't know how long this lasts, so I think thinking outside the box is it's time to not be sleepwalking now and get caught off guard when we're saying, well, what do we do? We're at critical staffing levels and need to proceed.
So
So,
I'm going to stick my head in here. Hi, Dave and guys.
hi.
Yay, welcome, Bill. Hope everything's okay.
They sent me a picture of what came out, so
Oh.
Puppies, they eat everything, including
they
socks.
do. And this one does eat a great deal of things, but luckily it didn't have to be surgically done. So that's the best part of this all. So a couple of comments here that spread along the theme. And the first thing is, I do want to go back, and I think it was very cool that these academic individuals that were able to, in Australia and New Zealand, were able to put this paper together to talk firsthand why it's actually fresh in their minds and happening and everything. And I think this shows the strength of the EMS education that exists in those two countries. That I hope that some days we can aspire to that same level of academic rigor and capabilities to do research within our classrooms and in our programs and stuff to the same level, and have that kind of development. So I think, again, hats off to them for the work they've done. Just on the last topic, Dave, is one of the things I've noticed has happened is a lot of the private ambulance providers are laying off employees due to a decrease in call volumes. And it's happened here for the place I work for about 6 months. They, of course, stopped using all of their PRN employees. And the very next thing they did is they furloughed over 100 of them, EMTs and paramedics. And they furloughed them with the idea that eventually they'll come back, but they can still get their health insurance. But then they're all waiting now for unemployment. And some of them have been waiting greater than 2 months almost now to get unemployment money. And so that's also going to change the workforce, because they may be looking for something more stable. But regardless of that, you touch on the important thing, is we still need to plan for the long run and not the short run. And so maybe this is an opportunity that we can't, as you say, sleep through, and we need to really rethink maybe all of how we do EMS education, and we build in the resiliency for something like this that will happen again. If it's happened once, it's going to happen again. It may be a different kind of catastrophic type thing that befalls us, but we need to find out what really works, and we need, again, to be preparing practitioners to be flexible and resilient for the kinds of things that they're going to be coming across throughout their entire career. The dogma of the past has no place. And I sometimes think that the greatest stumbling block is us. And I throw myself in there as an educator, that us that love standing in front of the classroom and preaching our immense knowledge and thinking that it's all being absorbed in everything, and just not the case.
Yeah. I am very sensitive to that concept that our run volumes dropped I think the social distancing and staying at home orders were really powerful in that way. I'm also feeling like that is a very temporary problem. If you kind of see the surges that occurred in New York and in New Jersey, it feels to me like those pieces are very transient. I know our run volume is back to where it was pretty much, and now feeling the pressure of these quote unquote, the country reopening, but also the local movement of patients with COVID, in particular nursing homes, et cetera. um, I'm I'm sensitive to the fact that, in fact, there was just on an international webinar, AFC talked about the shrinking budgets for cities and the fact that they may have to lay off personnel because city and government budgets might be affected as well. So I do want to, I think, just, I don't know, remind ourselves that when in times of economic crisis, education flourishes. So when people don't have a job or are struggling, and there's plenty more people who are out of a job, I think, looking for a job in healthcare, then we see a huge uptick in people going to school. And I would imagine that we will see that here coming up in the next, year or two. And I'm not as concerned about the number of students coming in, but it is tragic for those of us who are, furloughed, and I don't want to minimize that either.
Yeah,
Yeah, and
the
Dave,
college enrollment paradox, they call that. I'm sorry, Katie. They call it the college enrollment paradox, right? So college enrollment typically is in greatest demand when the economy dips, and yet that's when they have the fewest resources to accept the demand. Sorry about that, Katie. Go ahead.
no, I was just going to say too, I was struck by one of the quotes from the anatomist that they featured in this article, was that online teaching extends the workday and the working week to now include weekend work, and the volume of email has increased exponentially. So when we're thinking about this, this is the education podcast, from the perspective of the educator, I think a lot of us are feeling that. I mean, that quote really resonated with me, that there's so much more work now, and we're just thinking that more students are going to want to enroll, and we have to solve these problems and then also answer all the emails and figure out
Don't jump, Katie, don't jump.
Yeah, I'm gonna say though too, as somebody who started teaching online many years ago, those who are established distance educators already knew that. So they knew that the amount of work to set up and to establish and to document and everything is very high. So when people have been forced into it, now say we want extra compensation for this, and we've got that's been a real challenge, and I understand it. But a lot of experienced distance educators are saying you're experiencing what I experienced when I first started. So it was.
Yeah, we agree. We're
And I
also
think,
our own worst enemy because we think we need to
Yes.
reinvent the wheel. And I really appreciated in this paper that there are multiple they allude multiple times to this concept of don't reinvent the wheel. There
Yes.
are the textbooks actually come with websites that are rich with material. It's just that we think we need to re-demonstrate or redo it or need to find something that's alternative in YouTube. And maybe we do, maybe it's just the thing that we didn't quite want to show. So, there's quite a bit of stuff available already. And it does feel like people are kind of going, well, I didn't even, it's just not there. I like Mark Pincus is joining us from Las Vegas. Hi, Mark, love you. Let us know if anybody let us know if you need to be unmuted and want to make a comment. But Las Vegas finished an EMT class that resumed with modifications, smaller classes, class sizes, larger rooms for distancing, and masks are worn, mannequins are continuously disinfected. So I do think that when we used to say, I have my PPE on, or gloves, gown, goggles, and nobody wore them, suddenly in this environment that becomes an absolute reality. And I'm glad, at least in Las Vegas, they had the opportunity to do that. We've had some serious challenges with governmental closure or university or institutional closure, where either a fire department or the university or institution where you're teaching says you will not and cannot. And so, you know, I don't know, even teaching, we're teaching some scouts to do wilderness first aid, and it's pretty much go into your backyard. And I do love, we have a video of one of our students at UCLA that's using an ironing board as their backboard. So very creative, and obviously demonstrating an assessment on their brother or sister and able to do it perfectly. So you talk about, you know, whether or not we can adapt and at least get concepts down that will make in-person labs so much easier and faster. I think that's really good. So it's not by any chance ideal, but it is real.
So some of the other things brought up about instruction. So we're still on the, you know, kind of first challenge the first theme, which was on the staff and the faculty and technical and professional staff. One of the challenges too is the transition time. Did the university pause and allow for some transition time versus no pause? Teaching doesn't need to stop. We need to, you know, keep going versus, you know, face-to-face teaching stopped entirely. And they just, you know, yeah, maybe just continued on. So you can see that this is variable. That's actually an interesting research question, and I'm sure it depends upon the, you know, the university itself and the number of faculty that are already trained and that kind of thing. But you can see that it varied widely. There's from none, 5 of the 10 institutions had
Right.
no
Just do
transition
it
whatsoever.
now.
Keep going. And we don't know. Did they already have the resources? We're not sure. Versus, you know, as long as 10 days. So, and around here it was the same thing. We saw some, you know, colleges say, all right, we're taking 3 days and we're resuming on, you know, the 18th of March, or we're taking this week, we're switching spring break, and we're, you know, it came right around that time for us. So all over the place, and we don't know what's optimal when it comes to this. So that might be a question to answer as well, is how do you assess your own resources at your college and whether or not you need to, you know, depending upon this first column too, whether you have, you know, electronic, digital kind of supporting online learning, you know, that capacity, the capacity of the educators and the engagement of the staff and that kind of thing, you know, and then determining whether that puts you into a certain optimal week. I mean, that's a question in itself. We have a few comments coming in too. We can move on to students now too.
Well,
'Cause
actually, I think this business about this amount of time for transition is a great point to bring in Jeff Rollman's mental health comment and question. It's just about, you know, we already had a whole lot of mental health wellness issues in EMS, and here we are, you know, throwing educators right under the bus, going, you have no time to prepare, get to work, go to teach online, you know, meet with the students on Zoom, and you're going to do it with your dog in the background, your kids, if you have kids running around telling you that their classes are canceled, and it's and you have no way of, you know, now it's total no privacy. Here's my living room, guys. This is where I live, kind of thing.
Yeah.
So I do like the concept of addressing this and addressing mental wellness, and just also, I have to say, from a provider standpoint, anyone who tells you that they're not afraid while they're working on an ambulance right now is, I think, lying. You know, when I watch my mask move when I'm lifting a patient, I'm thinking, there's no way I have a full seal, and my gown rips because I just sat down on a bench seat and I'm just too fat for it, or it's just too thin. You just feel like you're exposed, and the mental your capacity to come home and want to learn after that, or during that when the educators find us and say, hey, we've got a just-in-time training event, is limited because of that emotional mental capacity. So I'm very sensitive to the concept that we are going to need to be way more tolerant of students that they may not be able to pay full attention because of true distractions that are necessary in their homes. And I'm also sensitive to the comment about, gosh, there's a lot of time right now in which there's some people locked up in their homes with nothing to do. And so the concept that we're providing the education, my teenage sons are sitting there going, yeah, I already did my homework. It lasted all of 5 minutes and the check-in was 2 minutes. And you think, gosh, this is, you can learn something else quickly. So difficult.
I like this. We had this discussion because I was recently over the PE and athletics and dance department, and we had this discussion about what can and can't be taught online or remotely. And at a time when people are shut in place, that's the time when you actually kind of need these yoga classes and synchronous
Yes,
walking for
yes.
wellness classes. So we had this discussion at the college, and they were saying, well, I guess those will have to be canceled. And the teachers like, no, we know how to do this with Zoom and Google Classroom and other things. And it's probably great for people's well-being right now to take walking for wellness and yoga. So yeah, that was an interesting assumption immediately that these can't be taught online, and then bring in the discipline experts, the faculty who teach them, who say actually we can, and we find it very important right now. So it was an interesting thing. We have a comment also from Aaron Raleigh. Hi, Aaron. He is a former faculty with me, and actually a graduate of our program, who is a paramedic heading to medical school in July. Congratulations, Aaron. So you're going to be confronted with the question that you have, which is, was there a clarification as to whether the donor programs and cadaver labs were in flux because of being possible COVID vectors or
Great
close
question.
contact? Yeah, excellent question. And they do mention it later that that is one that's kind of hovering out there. What's going to be the status of these donor programs, given the possible concerns about them being a vector? So I think that was brought up late in the paper about one of the things that's kind of hovering out there as an unknown. So
Yeah.
yeah.
And I don't know that there's, we could pretend to know the answer, but we don't really. So surely the virus, we will understand the virus better and understand its life on surfaces and actually cadavers or other tissues that we work with in terms of, the transmission and the danger. It's just too early. And that's part of the difficulty, is no one knows. And so managing uncertainty, I used to think as a paramedic, you're always managing uncertainty, right? You're just, the tones can go off. You can go anywhere, anytime. You can show up at any kind of emergency. You're just going, the ambiguity and uncertainty is our business. And it's fascinating how, 30 years ago, actually 35 years ago, I was giving 2 amps of bicarb before we started chest compressions, and thinking that was the state, that we were saving lives because we were giving bicarb before we started chest compressions. So I feel like sometimes this hanging our hat on false information, going, well, I know that, if I get sick, remdesivir is going to help me, or hydrochloroquine is going to prevent it, or I heard one person say, "Oh, smokers aren't getting it
Yeah.
in France because they're smoking, so you start smoking." You start thinking, hindsight's 2020. We don't know, and that managing that fear of the unknown is all about this particular paper. There's a lot of fear, particularly when we get to assessments, as to whether we know if they know, and it's that same concept of the teachers afraid, the students are afraid. They don't really want to go out there and start working without having actually done this in a controlled environment. And I will be the first one. Bill Toon can back me up with his gray hair. That when we stepped on the ambulance And it was the first time we'd ever done something, because our EMT class was not like fancy and had a whole bunch of simulation. It's like the theory of diabetes. Okay, there's a diabetic. Now what are you going to do? So it was those mentors and guides that were on the job training us, going,
Yes.
oh yeah, look, that's what the abdomen looks like when it's been sliced open from a stab wound. And you're like, wow, I didn't realize the colon was that, sausage like. And it's just unfortunate. I wouldn't wish it on anybody, but I also don't think it's impossible. And that's where being forced into this we may need to adjust.
Yeah, exactly.
Well,
Um,
and
Go ahead,
I'm
Bill.
sorry, I know you like to continue and being the dutiful person to make sure you review every aspect of the paper that you're needing to get through ours.
You're like a
But
mind reader.
yes, so I think though that Dave, I don't disagree with what you say. It's interesting, how can we need to start preparing now? And I'm sure some people are doing this very well, and other people are going to react to it. Is how do we really move forward? You said how important PPE is. I think PPE has always been important,
Yes.
but it's not been practiced even in the field as
Mhm.
religiously. And
Mhm.
it's also, for an education program to do PPE is actually expensive. If you want them to change gloves as frequently as they're supposed to change gloves, they can get very expensive. We used to go through, and I was basing this on HIV at the time, and I said, okay, they need to practice all the time wearing gloves. And luckily, I was a hospital-based thing, and I just went down with my account number, and I used to take cases of gloves at a time that would get me through maybe a month worth of practical labs, because then when they were done, into the trash they went, another pair went on, and that's expensive. And
Yeah,
let alone the environmental impact that makes. I mean, we can't even, it's
sure.
astronomical to think of it, but if you really want to change someone's behavior and you really want them to practice the way we preach, then we have to
Sure.
create that environment, and then it needs to be reinforced when it gets out to the field. And we often see people not, I won't even talk about seatbelts. That one still unnerves me. But you talk about people wearing, when they are doing invasive procedures, how many people were wearing protective gear when they were doing intubations in the
Of
past?
course, of course, of course.
Just
But and we can all agree that we went into, at least in a modern rendition of EMS in the U.S., we've gone to many disposable things. You mentioned gloves and masks, gowns. They are all feeling very disposable. They're not feeling, they are disposable. And then of course now on the ambulance, they're telling me reuse that mask. Like put it very carefully, put it face down, and or the inside, so that you can pick it back up and make sure you wear it again. Whereas I think some of our friends in Latin America are using washable, reusable things. So perhaps wearing sort of dishwasher rubber gloves and a P100 mask that's assigned to you personally that you can clean will become the new normal, instead of the let's just burn through disposable things we have to keep buying. I remember when we switched to pads from defibrillation and said, guess what, now we're gonna have to buy pads every time we apply them, even to whether if we think we're going to defibrillate. And in third world countries, people said, no, we're keeping the paddles because we don't have to keep buying pads. So I do think we have to have a change in the chip, a change in the way we think about some of that supply demand. And I'm glad you brought it up, because I think teaching anatomy and teaching and what they're saying in this very paper is exactly right, that the changes that we're making now may actually be good changes long term. We have to see what's sustainable.
Yep.
And
I love the
certainly,
title of their section, compromise, adapt, and be flexible. I feel like it could be a mantra that we just use.
Yeah.
Yeah.
And Dave, that became firsthand to me as a group of my students participated in training in Kenya. And they came back with these stories of the students, after they were teaching them to tape wounds and tape the head down for spinal immobilization, all this stuff. They later found the students going through the trash and salvaging the tape, using pencils and rewinding the tape and taking gauze
Yeah.
with the moulage on it and cleaning it and laying it
Yeah.
out in the sun to clean. And again, we lived in such a disposable lifestyle. But again, where's the safety point of that? There's got to be a way to look at it. We've got a lot of smart people, but it is fascinating how this and Katie's correct in how we need to approach this, adapting and being flexible and everything.
Some of
We
our
need a new
students,
approach.
some of our students used shoelaces or string to practice how to put on a nasal cannula at home. Michael Caduce was coaching them on how to create an oxygen bottle out of the roll of toilet paper and a pop bottle. And I do think it begs the question, how much of that can we do so that everybody goes home with a kit that they can practice with? And it may not be as expensive as we think, is all I'm saying. And where anatomy and physiology are concerned, I think three-dimensional objects that approximate what a human body is and directions on how to make them is a very hands-on exercise that essentially, if you make your own cadaver, you're learning where everything goes and how it fits together. It's a pretty good exercise and could actually, ideal, no, but real, yes, especially for EMS.
I think what Katie said was so important, and what you're saying, you guys are talking about just making it stick in practice out in the field, but making it stick in education practice is equally, if not more important than, in terms of practicing evidence-based teaching strategies. How can we make instructors, and they do mention in here that personal education philosophy came into this, which I think is interesting, because this education we have some evidence-based active learning practices that we know work, and how can we make those stick in EMS? That's I think a really important question. I would like to move to the student perspective. Now, they didn't interview students, but they interviewed these anatomists, educators, and asked, and one of the themes that came up was students and the impact on students. And what they outlined, and a few things I think are really important that relate to some things that we've been talking about. One is the fear of that they won't be progressing to completion. So how many people are facing the incomplete with the hope that they'll be coming in to complete? Or like you said, how many of these provisional things are actually, licenses are actually being issued? Financial pressures, of course, of lost income, and we know that all the challenges of being at home and missing out or not getting what they paid for. I know that was sort of part of some of the early things. Some of that was I thought was a little bit annoying, because it seemed to come from a very privileged group to say, well, I'm not getting what I'm paid for, what I paid for. I guess that's the importance of having a student learning outcomes very clearly outlined, that don't necessarily pigeonhole you into one particular type of teaching, but actually can achieve it in many ways. And then the other thing that I thought that's very important, that we've all probably thought of, is equity and access. So how can we, the academics were concerned about student learning, and the ability to meet students' needs and their accessibility to things like, actually poor internet access, or if you were doing synchronous, they mentioned time zones. So if you have differences in time zones in your area, and now you've got multiple different you have a requirement for a synchronous lecture, there's sort of challenges there figuring out the differences there. One of the questions I have, though, about equity is the poor Wi-Fi in rural areas. I mean, to me, it just the inability to access in rural areas doesn't make sense to me at all, because this is where the need is the greatest for distance education, and where the benefits can be reaped for bringing more people to the table if you have access in areas of need. And I know, Bill, you mentioned this on one of our podcasts before, just being out in a rural area, not having access to, high-speed internet, and that was a big limitation. So we see that in our rural areas, but
It
also,
doesn't even necessarily. So I was working in Loudoun County,
yeah,
Virginia, northern Virginia, a very well established, but half the county was very populated and the other half wasn't. And so there was just between east and west was who had the capabilities. And when we talked about going to online learning, the issues that came from the service members, both volunteer and the meet the career needs, was really a big deal. And so it can't be just, you just can't look at it as being just urban and suburban. It's the access to
yeah.
high speed internet, no matter where you are, is an issue, and then let alone the equipment.
Yes. Yeah. And then the worry about, doing things synchronous and online and requiring lots of bandwidth, and then do the same thing when it came to assessments, running assessments. This concern over, well, there'll be collusion. We need to have them, live and be able to see this, to see things in person. And I thought that whole segment on assessments was really interesting. They thought it was the most complicated issue that and this is where educators kind of were divided, and institutions. Some were focused on making sure they had assessments where, collusion or cheating became irrelevant by using a number of different, formats, and others just accepted it as, look, this is inevitable, and we're going to focus on teaching and learning and engagement and collaboration, not on, these, absolute
Yeah, high
assessments.
stakes exams.
Hmm.
I really love that section too. I want to caution every educator listening to this to not just anybody who's created a valid and reliable exam and had to do all the statistics for it is not going to be the first person to say, oh, let's just, put it online so everybody can copy it, and then I have to create a new one for my next class. So I think holding those high stakes exams for in-person events and using other more readily available questions that come from test banks that are less secure is the answer, and that interactivity. I also like, just because we're running out of time, I want to make sure we say, Jeff Rollman had another great comment about communities of
Yes.
practice, because this paper does talk about how important it was for the universities to share their collective knowledge and be able to do some networking. And here again is this concept of, you don't have to reinvent the wheel all by yourself. We should have a way for people to be able to interconnect. And I want to make sure we mention NAMSE is a good way. The Paramedic Google Group is
Yes.
another. There are ways in which educators are sharing best practices and need to pool together to accomplish some things, because some of us are stronger in some areas and others in others.
I want to thank Katie too for sharing so often some of their innovative teaching practices. I think you've helped so many through the webinar, and again, like Dave mentioned, the Google groups and NEMC and other groups that can get together and continue this. I think it's fantastic. And thank you, Jeff, for bringing that up. That was definitely something that I'm noticing as a strong point, and I'm wondering if some of the folks that are really struggling out there are not taking advantage of the large community of practice out there, that we're all going through this together, and we're experiencing the same thing, so we can share ideas. Sharing this infographic too, that I thought was a great, kind of final image to take a look at. In the paper, they shared an infographic that showed their 6 C's of anatomy education during the COVID-19 pandemic. So this is a great example of this kind of community of practice, to share something that's in one. I'm a huge fan of infographics, on one page, to show kind of the principles of, change and flexibility, just like Katie, you were talking about, clarifying expectations, clear communication, constructive alignment, community care, and continuity planning. And you can see all the different things that they used in this, between their lectures and practical and online assessments. So I think this is a great thing. Do you guys have any final comments since we're getting to the top of the hour here?
Just to continue to share and update, I think Robert Sklar here is asking, well, where do I get some of these things?
Great
Visit
question.
nemsi.org. Visit the there's a even for difficult things like the Society for Simulation in Healthcare has been posting a bunch of different webinars to talk about how to do simulation in this context. So the repositories are growing and the websites are buzzing with, here's some alternatives on how to do it. The webinars that each association is doing, but definitely check into those, I think, as you move forward.
Great. Katie, do you have any final comments?
Well, I just thought that was really like powerful for me as an educator, the section of the paper that said that the barriers to previously moving online were related to the notions that educators had about anatomy having to be in person. And I think that that is so true in EMS, that we have these notions that we can't do it online. So I'm just going to take that as a self-reflection and a challenge to myself to say, well, don't have a preconceived notion. What can you do? Use the section of that paper that said, look at the outcomes and make it happen. So I thought that was really powerful.
Excellent. Bill? Is Bill around still?
Yes, I'm still here. I went in, and I can go pick up my puppy, so that makes life really good.
Oh, good.
I think I love the paper, and I loved what Katie just said before. I said it earlier. We, as educators, need to step up our skill set and our game. We need to get out of the dogma of the past. While I don't think you can do nothing but pure online, we need to get more creative about how we can get the psychomotor, how we can work on the affective domain, and we need to be prepared. And there's going to be a lot said for hybrid models of things. And I think if we prepare ourselves better to go online in the future, it will be less of a scramble. And I know some programs, when I worked at Northwest Arkansas Community College, they had already well adapted into a hybrid model for their paramedic program. And so usually when people came into class, they were only coming in for the psychomotor component of things, and very little lecture, if anything at all. So some places were prepared for this, others were not. We all need to step up our game. And I think we're the stumbling block, not necessarily the providers.
Yeah. To be continued. Thank you all for joining us. This is a great discussion. There are many more ahead, so please keep in tune and don't forget to keep in touch too. Thank you for joining us. We will be back with the Education Research Podcast at the PCRF on Friday, June 26th, 2020 at 10 a.m. Pacific, noon Central. But we'll be back before then with the Clinical Podcast on Monday, June 8th, 10 a.m. Pacific, noon Central. If you want to present an upcoming article, don't forget to email David Page at dpage@emsed.net. See you soon.